Hey guys, this is a quick video I did with Ryan Shore. I'm working on teaching the public directly, so if you're interested in doing one of these one-on-one live streams with me, please contact me. Let me know what you're dealing with. I'd be happy to chat with you about it. I don't have specifically set fees for this. It's kind of a new thing I want to do. So contact me, let me know, but I'm going to work on Ryan Shore and help him with some of his shoulder pain. And I'm going to show you techniques that you can use to work on your own shoulder pain as well. Thank you guys so much for tuning in. If you have any questions, just write down below. So
Got it.
tell me what you're having problems with.
So my shoulder, I've been looking at physical therapists online, but when lifting my shoulder, especially like a
Yeah.
few months ago, before I was doing workouts, it was popping, it was hurting a lot. Sometimes it'd be like that, and just kind of moving, even especially do like overpress machine. I
Okay.
mean, I couldn't do like 5 pounds, but your infraspinatus, releasing helps, I think, a lot, but
Okay.
I think sometimes when I'm still abducting my arm, like, it's still like not the best,
Yeah.
you know.
So
But
where are you actually feeling, like if you're sitting, do
uh
you feel any pain at all?
no, not right now.
Okay.
No, not.
And then normally no pain.
Yeah, no. Ever since I've been doing like workouts, I guess,
Yeah.
and doing some releasing, that helped a lot, better than stretching does. So yeah,
Okay.
definitely,
But when you use it, you get like pinching in the front.
especially in the front. Yeah,
Okay.
and sometimes I guess I'm a server, so when I lift plates, sometimes it can be like down here, and sometimes it can even be in the biceps.
Yeah.
And yeah,
Okay. Uh the challenge with the shoulder, especially through the cameras, is it's a
mhm,
really complex joint. It has more range of motion than any joint in the body, which means it could be a whole host of muscles around this joint that are causing the issue. And
got it.
then it's a little bit like, do you ever get your tires aligned on your car?
Yeah, yeah,
If one tire for some reason turns a little bit, it'll start to
mhm,
wear on the outside. You ever notice that?
yeah. What do you mean?
A shoulder joint isn't the same thing, but it's like, what if one or two of the muscles in your shoulder joint gets tight and it makes this shoulder turn so that it's like rubbing? Does it make
Yeah,
sense?
yeah. Well, also, like a few years ago, I used to play football and all that, and for quarterback, you bring your arm back,
Yeah.
whatever. And I wish I could show you a picture, but anyway, I was trying to copy this dude. You know how pitchers externally rotate very much like that? I was trying to do that with the football, and that's what I think kind of messed my shoulder up,
Okay.
especially that. I feel like,
Yeah.
yeah,
It's like there's so many potential muscles it could
yeah,
be, and there's complexity because there's sports, there's like wait staff, like carrying platters of food. Like
mhm,
even when you said infraspinatus, the thing is when people have an infraspinatus problem and pain, typically they do this,
got it.
but they'll press in the back, and it's like they'll
Mhm,
come in and they're like, in my shoulder it won't go away, and it's like it's because of the muscle in the back of the shoulder blade. Does it make sense?
got it.
So that's where some of the complexity is, where I'm trying to figure out, what muscle it is you're dealing with. Do you have a foam roller with you?
I do have a foam roller.
Okay.
It's
Do
not
you
that
have like
long.
a tennis ball or a lacrosse ball?
I have a baseball, tennis ball, and a golf ball.
No, those will work. Do you
Okay.
have like a back knobber at all? Because you talked about your supraspinatus.
You mean those like long things? I do not know. I need a.
Theracane. Okay. I'm gonna grab mine real quick just so I can show that. Just in
Got
case
it.
anybody sees this video later, they can reference it. I'll put a link down below because this will help in some instances depending on where it's at.
Uh-huh. Sorry, hold on. Oh,
Oh
my
no, you're
camera.
fine. The issue is, like, for instance, if it's up here, it's like you're not going to be able to get enough pressure so you could press down into the trapezius, the supraspinatus. If it's in the back on that infraspinatus, you could,
Yeah.
pull it to the back and start to like work on those muscle fibers on the shoulder blade itself. And
See
then
that?
for you, what do you think it is? Because you told me supraspinatus. You think it's right up
Yeah.
here.
I mean, so recently, it used to, especially, I think, deep in the shoulder plane, deep in the front, and sometimes it can just rub, I feel like. So I think maybe it's shoulder impingement, maybe something like that. Maybe
Yeah.
like, that. But I mean, I think it could be that. And maybe my supraspinatus could just be a little bit tight. I would like to release it better than like, stretching it. But
Whenever you get the discomfort after you
yeah.
stop doing the weights,
Mhm.
does it go away immediately?
Let me think. I haven't done that in like a month or so because I was like really scared. No, it doesn't go away immediately. I'll say that. It doesn't go like a quick fix or whatever.
Yeah.
Let me think. Maybe it does. I maybe need to do that again and maybe see what happens. But you know,
The sensation you feel, is it sharp or is it broad?
it's definitely sharp and deep. If it's
Okay.
ever like deep, like kind of in there.
And then when it's deep in the shoulder, does it feel like you said it feels like it goes down your arm, sometimes through the bicep?
Oh yeah, definitely. Sometimes the bicep. I think like a
Okay.
week ago, it was like really bad or whatever, and I
Yeah.
thought it was like, maybe bicep tendonitis or whatever. But in doing the releasing after that, it kind of stopped or whatever. And sometimes I'll
And
get
we'll talk about that. I have an
yeah,
idea of what might be going on, but I'm going to check this with you, and then we might have to go through several muscles to try to find out the most complicated issues I see. Or
mhm,
let's say somebody has referred pain. I'll use that as a general blanket term for they've got an issue with their bicep and they have some pain in their elbow. They'll sit there and rub around their elbow, but it's never getting up here where necessarily the problem is. Make sense?
got it.
So they'll have an issue, but I have to help them figure out what's causing that. And it's
Mhm,
almost like a rope. Like if it's your bicep, a lot of times what I'll see is they'll have pain further down the arm, but it's coming from this top portion of the bicep where it's like pulling. It's like a rope. It's been
yeah,
bunched up on one side. Make sense?
yeah,
The issue with what you're describing is I'm actually wondering if it's not your neck and your
mhm,
anterior scalene
mhm,
clamping down when you're lifting weights. And what I see with people who lift weights a lot is they'll put the bar, for instance, like if they're doing squats, they'll put the bar back here and then they're using their neck muscles to stabilize that bar.
got it.
So they're using these little tiny muscles to stabilize that. And what I see with people generally is, when I say generally, what I mean is office workers, they're at a desk. The anterior scalene pulls the head forward like this.
Got it.
So when that muscle shortens, what it does is it presses on a nerve trunk from C6 and C7. They're the base of your neck here. Those
Mhm.
muscles go down your, I'm sorry, those muscles cover a nerve trunk that goes down your arm. You ever hear people talk about the brachial plexus?
Yeah, I was just about to say that.
It's
Yeah.
just a nerve trunk
Mhm.
that goes down the arm. So anywhere along that trunk, they could have some sort of issue. They could have
Yeah.
like the pec minor is tight. They could have this, they could have that. There's all sorts of things. But
Yeah.
the way you're describing it almost sounds like it's the neck. And the
Mhm.
reason why I'm saying that is if somebody has an infraspinatus problem, it's always this. Like
Got it.
I'll ask the client, where does it hurt? And they're like, right here. And I'm like,
Mhm.
oh, because I know almost positively it's in the back. When they do this, and then they say it's deep in the shoulder. I mean, does it feel like it's in the center of the bone? Yes.
Okay.
Is that what you're saying?
No, I mean it's kind of hard to explain. I would say it would be like it's not like because I haven't had it for like a month or two. It's just kind of hard, kind of
Yeah.
forget all that. But I mean, it would be in there, like kind of around here, just be in there. And sometimes, but especially when I'll just lift up like a little bit, it would pop. Like I
Yep.
feel in the center of my thing. But yeah, those squat things, I'm talking about like because I don't do squats. Like let's say you have a machine because it's usually for maybe triceps or whatever. You got a gym and you're just doing this, not like a barbell, but you're
Yeah.
just pushing up and then coming down. Especially that, my arm pain, especially that. I mean, even doing with a resistance band I have, you get on a kneeling position and you put it right here and you're just
Yeah.
doing this. That kind of has pain in front of my shoulder a little bit, you know?
Yeah.
And I feel like that's what that makes sense.
And
But
it could be, and this is the
mhm,
challenge. There's so many different muscles that could be part of the root issue. And
yeah,
then the most challenging stuff I see is, let's say you've got 4 different muscles.
mhm,
And all four of those muscles are causing this referred pain pattern or issue you're having. And then I've got to slowly unwind each of them. And that's a little challenging through the cameras. I want to check in your neck first just to see.
Yeah, of
And
course.
we'll know really fast. When you do this, it's not, yeah, that's kind of it. No.
Okay.
Like you'll go, that's it. That's exactly what I've been feeling, if that is in fact the case. I'm gonna grab a chair here so I can sit a little closer to this camera so you see this.
Yeah,
Let's
of
see
course.
if I can still capture myself here. Yeah, that looks like it's close enough. I'll actually zoom in just a little bit. So more issues on the right side or the left?
Sorry, just give me 1 second right
Oh, no
now.
worries.
All right.
There you go.
Oh,
So right side or left?
definitely more left side, I say.
Left side. Okay. I'm gonna come in from this side because I think you're gonna be able to see this, but it's the same thing on either side of the body. Okay.
Okay.
Those nerve trunks come from your spinal cord, then they go out from the cervical spine, like down your arm. And
Yeah.
here's what's going to happen. You got a muscle here called your SCM.
Yes,
When it's shortened like this, I can feel this muscle like pop up.
Uh-huh.
I can usually grab it with a pinch motion like this. I don't want to be in front of this muscle. I want to be behind it.
Okay. Oh, like the scalings, like all around here. Got it.
Yep. And when I do this, I can feel that muscle shorten the SCM, but my thumb is going to be behind it. My thumb is actually going to go down.
Uh-huh.
And then once I get to about right there, I can feel this light up in my shoulder joint.
Got it. So I'm supposed to just move my head?
Yeah, you can move like slowly. What I've got is a broad thumb pad that I'm pressing right into that muscle.
Got it.
And if you hit it 9 times out of 10, even if it's not the issue, it'll still light up. You'll still feel it like light up around your shoulder and your arm. And it feels like you're pressing right into the neck itself. Let me take this off. That'll be a little easier to see.
Got it.
Because my SCM's right in front of it.
Uh-huh.
I can feel it right there if I take my finger and run it back and forth.
Uh-huh.
But if I go down and I hit right there, it starts to light up in my shoulder. I find that if I'm going to sit there for a while, it's easier for me to turn my thumb and hand that way. And it lights up right in that spot right there. Like I feel it right deep down in there. And I don't even have a problem with this arm.
Yeah, I feel like maybe a sensation, but that's about like it.
You feel what?
Like a sensation, but not like pain. That makes sense. I don't know.
So what happens if you turn your hand up like this, your palms up, and you're coming in?
No. Not like any pain or
whatever. Here's my collarbone, about right there.
Uh-huh.
Then my SCM's in front of where my thumb is.
Got it.
Got it. Lights up right there.
Right here. So it'd be like right here, right? Like here's
that looks about like it. Again, this is kind of a hard one to pinpoint over the cameras. Can you turn towards the camera just a little bit? Right there. There you go. That it makes it a little easier for me to see. So if you keep your head at neutral, does that make it easier?
I guess, but
instead of like bent over?
Yeah. But I mean, hold on. Yeah, I'm getting pain maybe a little bit, but like
in the back.
Yeah.
Okay. So on that muscle, it's a little short guy, but if you're at the top piece, it feels different than if you go down. I want you to go down a little bit towards that bottom piece.
Okay.
There you go. And you can rub the thumb if you need to back and forth. As long as you're behind the SCM, we're totally fine. There's my SCM. Go ahead.
Yeah, I can feel it now. Yeah.
Now, hold on. But when you feel it, is that where it lights up for you?
Hold on. Yeah, I would say the same kind of place, like on the top, kind of. Yeah.
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 And the thing is, I don't think it's necessarily just that muscle. I think there might be some other issues going on as well, but I want to pinpoint that because it's one that even if you go see a massage therapist, they'll bypass that completely. They won't even address that. Now
I
I'm
hear
going to
that.
come in on my opposite side. I want to do the opposite side so you can feel this
Hmm.
because it's the same thing. This is the SEM. I've got my thumb right in there. I don't know if you can see this on camera. I have to turn my head to see.
No,
There
it's
we go.
okay.
And then when I press back and in, it's like I'm pressing into the body of the vertebra. It feels like I'm pressing towards my spine, and it lights up right in my shoulder, right along that joint right there.
Try to do it, maybe.
I would do this. Can you go just a little bit further forward? Just a little
Of
bit.
course. Yeah.
Right there. Now I want you to press straight back and into your neck. Does it light up at all?
No, hold on. Maybe let me try a little like back and forth.
And yeah, you rub it back and forth. It'll almost feel like bone. The muscle's so tight. It's a support muscle. It never feels soft and buttery. It feels so tight. It almost feels like bone initially.
It does feel tight,
And
but
then
I
when I'm
guess
right
like
there, because I work on mine are never soft. I'm right there.
yeah,
I press in, and it lights up right across my shoulder right here. Ah, ah.
yeah, I'll say a little bit, but not like that pain. But I mean, yeah, I feel it tight and all that. Yes, sir.
So I think that might be part of it. There's
Got it.
other muscles that I want to check, and here's the
Mhm.
deal: because of the way you're using your body. Okay, so anything that lifts your arms up like this can be in for a spinatus. You drive, you tight,
Yeah.
weight staff, probably in particular. A lot of pressure. Now, when you're holding those platters, is it like this and you're contracting your bicep?
It's like a bottom, I guess. We'd hold plates like this.
Yeah, because you
Yeah,
have to contract here to be able to hold all of
yeah,
that. Yeah.
yeah, exactly.
Do you think you have more issues with the bicep or the tricep?
Oh, that's a good question. I guess bicep definitely. Yeah, definitely
Okay.
not as much as
Do
tricep.
you have a chair or something like that here with you?
Yeah, I could go get one.
Okay,
Yeah.
so we're gonna see how this works, and I'm gonna walk you through it. And this is
Okay.
just me trying to improvise based on whatever we've got. I'm putting on my sweater, my cardigan, inside out.
Is a rolly chair okay?
It should work fine. I'll show you what I'm about to do. I like this in particular. That's not a roller chair, but you'll see how I'm about to use it. So do you think one? We can look at both. Do you think it's more bicep or tricep?
Uh, Bicep, I'd say. Yeah, definitely
Okay.
bicep.
Here's the issue. It's really hard to, I mean, you could, but you have to
Yeah,
sit here and almost like overwork your hand to get in here. Do you think it's more towards the elbow or do you think it's higher up?
that's a great question. So last week, I guess it was definitely higher up, but now, I mean, working that infraspinatus and then releasing and massage, I kind of felt some like inside here, I would say. So I mean,
Okay.
but yeah,
This right in here, I put the sweater on for a reason. You'll see in a second. If I work on my own bicep,
hmm,
it feels kind of soft in the middle. And once I get towards the elbow, right about there, it feels kind of dense, tense, tight. If I'm going to work on this, one of the easier ways, this is a really sharp point.
yeah,
Your chair doesn't look like it's as sharp, looks like it's more padded.
yeah.
Oh,
It's
no, you
like
got a little bit of an edge. So what
yeah,
I
yeah.
want you to do is go slow. You're not trying to cause a bruise. I'm going to
Uh-huh.
hook my arm. Ugh. Ah. And I can move that elbow
Yeah.
any way that I want. If I need more pressure, I can come in. I'm not going to need more pressure. And this is why I
Yeah.
put my cardigan on. It's gonna dampen the sharpness of this edge right here.
Yeah.
Now, when you do that, is that referring down in your arm at all?
Uh, yeah, a little bit. Yeah.
Now I can take this and I'm gonna slide. I'm gonna go just a little bit forward and a little bit back just to see if a particular spot, it feels like it's a little more intense on the muscle when I lean just a little bit forward right there. Oh.
Yeah.
Now I'm going to slowly take it off because it's cutting off blood flow. I could feel it, my hand pink up after I took it off.
Mm-hmm.
Now, does it feel like it's there still, or does it feel like it's higher?
Um, doesn't really. I would say yeah, there. I guess.
Was there any improvement?
Hmm. So yeah, I would say yeah, a little bit. I guess yeah.
Okay. So I'm going to scoot in just a little bit closer. Same thing. I'm just working on a different part of the bicep.
Gotcha.
Ah. So it's very easy to lift the arm and kind of go in between the bicep and the tricep. I'm having to angle my arm down to be able to lean forward to get that right in there.
Yeah. I mean,
Ah. Oh. Now, is that spot more tender?
yeah, I would say so. Yeah, definitely.
Okay.
I'll
Does it
say
feel
it's definitely more tender going
does it
up.
feel connected to what you're dealing with?
Uh, no, I would say there's no really shoulder pain up there. But I'd
Ooh.
also say, right, I forgot to, I guess, mention, but like sometimes I guess when I like stretching it or maybe even do that, the spine of the scapula, maybe that's like the bone, I guess, sometimes it's a little bit sore or something, or maybe I'd like have some problems over here a little bit. That's like, or a little bit of pain right over here. I mean,
Yep.
but yeah, but no, I don't think so. The referred pain really, like,
So
no,
really what I'm looking for is when you describe that thing across the shoulder,
yeah,
if that doesn't improve, we have to keep working.
got it,
Or if we do it 2 or 3 times and nothing improves, I'm like, you need to see a doctor. I'm not sure what's going on. Yeah.
got it.
If we work the bicep, we did like a lower portion near the
Yep.
elbow and up towards the shoulder. No real improvement from that.
Now I would say no, just like try to get a little bit more on here, but
Okay.
no.
Now I'm gonna reverse it now, and I'm gonna go out to the tricep. But
Okay.
my arm, I'm gonna scoot down this way a little bit. My arm is extended now.
Yeah.
Oh. Now I can go closer to the elbow.
Hmm.
Oh. And I can go up the muscle into the belly. And I can go up. In my case, I'm probably a little closer to the shoulder right there. Oh. Oh. Ah. How's that?
It's good. It's just like the triceps are a little bit tight, but yeah,
Yeah.
nothing like it's not the same pain in the front or whatever. But I mean, yeah. I guess sometimes when I get in the back too, right? Like it would be I guess like where the bone ends and the AC joint right here, right?
Mhm.
Kind of hard to see, whatever. Like I guess like right under the spine, the scapula, kind of, and sometimes maybe that would confuse me on the side, whatever. But it'd be pretty close, and it would be like deep pain, right? Like the
Yeah,
kind of thing.
tons of muscle junction right there. It's like it's very, very difficult for
Mhm.
me at a distance to try to like isolate specifically. And
I
the
hear you.
issue is when you take your hands and you rub on that,
Yeah.
does it get any better? Do you get any relief?
Uh, I would say not really. No, just pressing
And
it.
and that's where, so I'm gonna change position on this just a little bit,
Yeah,
and then I'm gonna come in because this guy's pretty sharp. I don't even have my cardigan now.
I
But
hear
I'm
you.
getting more towards the teres group, more towards this axillary border. There's a crossover between infraspinatus, teres major and minor, your lats, even the subscap, like right through this area.
Yeah.
You can cross fiber friction right here. I'm not in the armpit. I'm a little bit posterior. Once I find something that's tight, I've got this junction right here. I can move my arm around. I get a little clunk in my shoulder. I'm going to put that over the chair right there.
Okay.
Oh.
I don't really find anything that's tight over there. Not really.
Doesn't feel that tight, or you're not getting much referred pain?
I'm not really anything tight that I can feel, right? No, not anything like tight when I move it.
And then when you lean onto the chair, any difference with the pressure? You can't fall over. It'll be a good bloopers reel, but we don't want you falling out of the chair.
No, not really. Not any like pain.
And then it looks to me like you're like this, like you're underneath.
Got it.
I'm going to turn my body so you can see this. I'm more on the back side.
Yeah, this is kind of hard, I guess. Hold on, let me lower it maybe a little bit. Yeah, I guess it's kind of hard with this chair.
Yeah, you got a chair that leans back. That's the difference. Is I got this more sharp, more firm guy.
Yeah. Wait, hold on. I think I got a little bit, but maybe I can go grab another chair.
No. We got other ways. So let's do this. Let's put the chair aside for a second. We're gonna go down to the mat. I want to use your foam roller and get into some of this and see if this helps.
Okay.
So I'm gonna scoot some of my stuff out of the way, make sure I don't knock over my coffee. So how squishy is your foam roller?
It's not that squishy. I mean, look.
Okay, it's pretty firm.
Yeah,
because this doesn't have a lot of give.
Got it.
And if you get like an extremely soft one, it's just going to smoosh down. You're not going to get the pressure that you need.
Got it.
Now, what I'm doing is that same side body. It's not here in the armpit. It's almost like to the side or to the back.
Gotcha.
And what I'm going to do is come down, and start to roll through there. I'll even use the edge of the foam roller to kind of pull myself back and forth. Let me change the angle on this just a little bit. Oh. Oh. And I get into a spot right here. I can still move my arm around and I can feel that junction, that axillary border right at the shoulder blade. And if I need more pressure, I just stack right there.
Yeah, I kind of feel something. Yeah, where I feel the pain in the top, right here.
Yeah. Now, if you're going to be here a while, if you get into something that's important and you're like, I can't, my head, you're going to have to come in and figure this out. Is grabbing bolsters and pillows and props, because you don't want to put your head in strain. You still want to deliver pressure to that area, right?
Yeah.
Like if you're going to hang out there for a little bit, I got to figure out how to deliver pressure and then give my head some support. Oh, okay. So I can lay there and keep going.
Gotcha.
Oh.
And it's right under so like the armpit, like right here, and it's right over here, right? Just making sure.
Yeah. So if you had to show, it's on the side. And you see where I'm red right here? It's because it's on this posterior side. This is the edge of the shoulder blade. If I come over here, it's also not a problem. Some people will also have shoulder pain from serratus right here.
Got it.
But what I'm really on is this junction right here. I'm not underneath in the armpit itself. I'm more to the side.
So you're on like the muscle kind of. So you mean?
Yeah. So
Okay.
it's hitting the edge of infraspinatus, but it's hitting where those muscles go right into that junction right there.
Gotcha.
And in my case, I'm able to stack to be able to get into it. Now, if you do that and you're like, that's it, but it's not sharp enough, we can move to a tennis ball.
Okay.
Yeah.
Oh, yeah. I mean, that's pretty sharp. Yeah, I would say the pain that's coming up, in the front. Yeah.
And the real test is this. We'll do this for another minute or two to have you sit up. And then when you sit up, does it relieve some of that discomfort? Because if it doesn't relieve some of that discomfort, that's where we got to kind of go back to the drawing board.
Okay.
So I'll show this for people at home.
Mm-hmm.
But when I'm coming in here, sometimes it'll be serratus, which is a muscle that pulls the shoulder blade forward. It's on the ribs here. Other times it'll be like the teres group, or sometimes even subscapularis. It's on the underside of the shoulder blade. It's kind of like the opposite of the infraspinatus. There's a muscle on either side. If I come in and I'm on my side, if I'm down on the ribs, normally it's more serratus anterior. If I come a little bit higher to the border, it's either the teres group, the infraspinatus, or sometimes the subscap. What I'll do is grab this edge and pull myself forward. So I'm grabbing right here to give some traction to pull that muscle to lengthen it that way. But it depends on where I feel it. Right now, I'm actually getting a little bit more light up in the tricep as I go up right into that edge, where it's almost like it feels like I'm sticking a screwdriver right up in this axillary border right here.
Yeah.
You dying over there?
I say it's definitely tight.
When you sit up now, how does it feel?
Yeah, definitely. I feel like, definitely more loose. Yeah. I mean, hold on. There's still a little pain, I guess, kind of running down. But yeah, I guess I would have more movement.
If I take somebody who doesn't have any pain and I work on their rotator cuff, muscles around the shoulder, they'll have more range of motion,
Gotcha.
which is great. The main thing I'm focusing on with you is like we're trying to get the discomfort and the pain to go away.
Yeah. Gotcha. I'll say it doesn't go away maybe when reaching the arm down, but when just, leaving it like this. Yeah. Goes away, I guess. Wait.
But when you lift it, it starts to light up.
Yeah, definitely when I lift it. Yeah. Definitely.
And it just pinches.
Yeah, like pinches. Yeah, definitely. That's the best way.
When you lift and it pinches, do you feel like there's involvement from that muscle in the neck, or you feel like it's just here?
I feel like it's there.
Okay.
When I'm lifting, actually, maybe it's something pinching with right in here. I guess like the end of the collarbone. And
sure.
Yeah.
Yeah.
Something like that. But
the issue that I see is a lot of people will come in and they'll say that they're trapped and their levator scapula. They'll always come in and press right here. The issue is I can take this and I can press on that, but it never seems to go away. Yeah. Now you have a more specific issue. You're lifting weights, you're doing very specific things, but I tell massage therapists this constantly. I see people who essentially every day, if they're office workers in Austin, they come in and they go, my upper back and my neck, my upper back and my neck, my upper back and my neck. And here's what the problem is. These muscles in the posterior are elongated and weak.
Mm,
They're not tight.
got
These
it.
muscles are tight and they're doing this. And they always wind up having pain here because they're sitting at a computer for just hours and hours, like coding, doing stuff. So half my job is trying to get their shoulder blades to go back, trying to
Yeah,
open the chest because they're slowly, what I tell people, they're turning into Smeagol, they're turning into the Gollum because
yeah,
they're like going down and forward like this. Make sense?
yeah, definitely.
What I don't know with what you're doing is like you need more strength to be able to like wait tables and carry those platters and trays,
Yeah.
and you're straining your body in like unique ways. Over time, if you continue to work on this, you would
Mhm.
probably tweak your exercise regimen to try to strengthen muscles that are weak to get a little bit more balance. But I'm
Got
just
it.
trying to see if we can get that core issue to go away. The challenge is if you came in and you used this and you like pressed in there,
Mhm.
is it going to make that shoulder thing go away for you at all?
The where the traps kind of closer to the neck.
Or yeah, or if it's up on top?
Uh, I'll say,
Because you
I'll say
got some
no.
benefit from infraspinatus. And
Yeah,
infraspinatus is at the back of the shoulder blade.
yeah.
Do you need more pressure up here?
Uh, I would say yeah, a little bit. Yeah,
Okay.
definitely.
So let's do this. You got a wall behind you. Can you grab that tennis ball?
Yeah.
And what I want you to do is just like I'm pressing right here. Let's see if you see this. Just like
Uh-huh.
I'm pressing back here. It's in the posterior. It's not on
Yes.
my shoulder blade. It's not on my spine. It's kind of on my rhomboids. It's around
Okay.
this whole area. You can reposition like if this was the wall, like you can kind of shimmy back and forth to find that spot. As long as you're
Got
not
it.
pressing on your spine, it's fine. You're not going to injure yourself. It can be intense. You don't want it to be painful. There you go.
Right there. Yeah. Yeah. It's
Now,
definitely.
Now,
Yeah. It's,
once you get that spot in, you can lean, you can like change body position. You can also lift that arm and start moving the arm around. There you go.
yeah.
And does that help at all?
Um, um, I would say so. Yeah.
Okay. Now, what happens? Do you need more pressure? Do you need to push?
Yeah, I would say so. Because it's not really any painful when I do this. Like
Yeah.
not any. Just maybe a little
And
bit.
we're just checking different spots because if you change the angle, you can get a little bit closer to on top. This on top piece is a little bit more difficult if it's supraspinatus, just
Yeah.
because of its location right on top of the shoulder blade. Eeh,
And it's you want
eeh.
me to be like inside, right? Like the wrong words are like inside the like I guess the inside the scapula. If that makes sense. Is that what I
Yep.
mean? The inside border. Okay, then.
Now here's the other piece. When you feel if you feel discomfort around the shoulder blade, is it always when I say shoulder blade, what I mean is the inside of the scapula right there, the inside of the shoulder
Yeah.
blade. Do you always feel it in like a little oval in the bottom?
Uh, no, definitely not. Not like a
No?
oval.
Okay.
Ooh, I felt like I don't know, like I was doing this right. I guess cracking or something. Rubbing. Say.
Now that is more along the shoulder blade, right?
Yeah.
I'm sorry, when I say shoulder blade, what I mean is it's more along the spine right here. It's a little harder to see. What
Yeah.
happens if you put the ball closer to the infraspinatus on top of the shoulder blade?
Yeah.
There you
Sure.
go.
On
When,
top or
when,
like. Yeah.
so when I say top, what I mean is your infraspinatus is
Uh-huh.
on the shoulder blade right here. When
Uh-huh.
I lift my arm like this, you'll feel the muscle pop up.
Yeah.
It's a big, huge muscle right on top of the shoulder blade. If you lean
Yeah.
back into that, you can kind of cross fiber friction. You'll have that tennis ball right on top of the shoulder blade. You said that muscle at least did help.
Yeah.
Yeah.
Definitely like releasing it. I used a golf ball and just like, laying on the
Ooh, the golf ball's mean. Whew.
yeah.
So
But
I'm using the wall to help you pinpoint a muscle. If you
yeah,
decide, okay, it is my infraspinatus, then you get the golf ball and you lay down on a rug. But this
yeah,
is like super, super firm because you're stacking body weight on top of that.
gotcha.
Yeah. And I've literally done stuff. I had a problem on my left side. I've literally done stuff where I'd have furniture and I'd come
Mhm.
in and press and then I could like, oh, if I had my arm up and let it hang off of something, I was getting better results. Lots of pressing on an area with some sort of mobilization to try to like access it.
Gotcha.
There you go.
Is popping okay or no? Maybe as
So
long
the popping can be just like tendons sliding
Mhm.
over. So long as it's not painful, I don't think it's a problem. Like, does your shoulder joint ever crack?
It used to a lot, definitely, for
Yeah.
maybe, um, I guess doing some workouts or something.
Because sometimes I'll get up in the morning and do this, and my shoulder click, it like cracks basically, just removing it. So
Yeah,
it's
yeah,
not a big deal. It's just like a knuckle,
yeah.
just
Wouldn't
like
no,
cracking a knuckle. Yeah.
would maybe I'd say maybe a crack like around here sometimes, but it would be painful, but not as much. It would be painful
Yeah.
though if I would like do that or like lift up my arm a little bit.
So in my case, one
Mm.
of the things that I see when I work with people, a lot of therapists, massage therapists, they'll look at supraspinatus and they'll talk about people's deltoids. They always
Yeah,
want to work on people's deltoids. And in all the years of clinical practice, I don't know how many people I've actually seen who are having problems with their deltoids. It always seemed to be other muscles around the shoulder joint. The deltoids are just where they feel it. This is infraspinatus. This is anterior scalene, like various. I've had people, they'll have pain right on the outside, about the size of a quarter,
yeah.
and it was their coracobrachialis. It's a muscle right in between
Also,
the
like,
the bicep and the tricep. But the
mhm.
coracobrachialis, like this, is infraspinatus helping pull the shoulder blade up, right?
Yeah.
Coracobrachialis is the opposite. It's the muscle that pulls the arm down and in. Yeah.
Oh, okay.
So I'd see people with problems, and the therapists always want to work externally. They always want to
Uh-huh.
work on like the deltoids. And other than like putting like forearm pressure when I work on somebody in the deltoids, I always found it was the rotator cuff or other muscles, not as much the deltoids themselves.
Gotcha.
Yeah.
Is there any I guess like other tests we can see, like my shoulder pain? Because like this online, I guess physical therapist I've been seeing, right? We did like some internal and external,
Yeah.
whatever. The external looked pretty good. They said my right one wasn't as, I guess as par or whatever with my left one or something.
Yeah.
But
The challenge I have is I don't know how much muscle testing
yeah,
holds up to scientific scrutiny. I don't know if that's exactly what you're referencing. And
yeah,
then for range of motion issues, this is the
yeah.
deeper issue as a yoga teacher. I tell somebody to do a yoga pose a certain way because of their hips.
Mm-hmm.
People's bony structures can be different,
Gotcha.
which means that my hips are pretty mobile compared to some people's, but the shape and structure of the bones, I can stretch tissue, I can stretch muscle, I can't stretch bone. And it's
Gotcha.
like what I tend to do is like, regardless of, let's say somebody else is a Gumby, they have just like a huge range of motion. They
Mm-hmm.
don't necessarily have pain compared to somebody who's an office worker who's just very stoved up and tight.
Mm-hmm.
It's like, yeah, generally people work with me, they feel a decrease in pain, they'll feel an increase in mobility.
Mm.
But if all I do is like, if their hamstring, if I work on a guy, this is his hamstring stretch.
Yeah.
He's
Yeah.
like, oh, I really feel it. Other people, I have to straighten their entire leg for them
I
to
hear.
start to feel that stretch. The difference is primarily what I'm doing is helping with pain. It does tend to increase mobility, but it's a short-term benefit. Does it make sense?
I know what you mean. Yeah,
Yeah.
I think because I used to do a ton of like infraspinatus, I guess, for a year now, whatever. Because I'm like, oh, I think that's the problem, and I just recently learned if you like, stretch it so much, you cause your shoulders to round or something like that. So I've been off in that. But yeah,
Yeah.
I've been doing that. But I have another question. When releasing it, right? To start with, I saw one of your videos where you have your arm on your ground and you just rotate. Um, if I have numbness sometimes, right? What should I do? Should I lay off of it a little bit, or should I?
So
Yeah.
I come from a background where, because I was helping people with chronic pain,
Mm-hmm.
my nervous system is keyed up in a slightly different way than most people. And the reason I say that is, some people, if I work with them, and I'll give this more clarity. If you came to me, you're having a problem, right? If I was going to work on you, you're not really asking for a massage.
Yeah. Yeah.
You're like, I got this thing. I need you to help me with that thing. And I'm like, cool, come lay down on this mat.
Yeah. Yeah.
That is a major divide between myself and some of my students, because they're like, I'm
Yeah.
like, listen, the table-based stuff doesn't give me access to my legs and feet and like full mobility. I can
Mm-hmm.
just leave his clothes on and I have all my tools available. I could assess this very, very quickly in about 5 minutes if I was there with you, because I'd
Gotcha.
be like, this muscle, this muscle, this muscle. I'm like squeezing on stuff, pressing on the scalene right there.
Yeah.
The difference is it's a little slower for me when I'm working through the cameras.
I hear you.
My pain was so bad. I'm going to tell you a quick story. I worked at a FedEx plant when I was in massage school. I got out of massage
Yeah.
school in 2002. So this was like 2002 was mainly the year that I was in school.
The
When I worked
baseball
at the
dog.
FedEx plant, there was a slide, and they would unload the packages off the 16 wheelers. They would come down this slide to my waist, and I had to sort packages. Guess what muscles this works?
I don't
Rotator cuff. My rotator
rotator.
cuff was fucked. It was
Oh,
real bad. When I got out of there, I was in massage school and they were working on me and they weren't addressing my rotator cuff the way it should have been addressed.
I hear you.
I could have like fucked me up real fast and like helped it. The issue was, it was in this weird area in infraspinatus that we weren't taught to address. I
Mm-hmm.
had an ache in my shoulder for months.
Oh my gosh.
Like, I literally was doing stuff where I was like hooking my shoulder blade on a shelf trying to pull it off just to get the pain to stop, because I'm a massage therapist. I just
Yeah.
studied all this anatomy. I destroyed my body working at that FedEx plant. I
Yeah.
was at a friend's house and he had a baseball bat, an aluminum baseball bat with that
Yeah.
knob on the end. And I had rubbed and I had pressed. I mean, I was in immense amounts of pain. Like, I could have easily gone to a doctor and asked for painkillers. I
Yeah.
laid down on that knob right here
Yeah.
for about 30 minutes.
Uh-huh.
And all I did was stack my body so I could that knob on that titanium bat, or what, metal bat,
Yeah.
aluminum, was never going to give.
Mm.
And I just hung out on that spot till this whole arm just lit up. Okay.
Gotcha.
The next day I was bruised. I mean, I was literally so tender to the touch that it was like, ow.
Yeah.
My arm never hurt the same way again, because that muscle had just compensated and tightened up, but I couldn't get to it, right? Because I can't, even if you press here, you can't do much.
Yeah.
But once I stacked it there, like super, super intense, my normal is to, what I say is, get into somebody's shit. When they come in for a massage, they're like, no, this is supposed to feel nice. And where's the softened lighting? And I'm like, that's not what I do here. I try to fix shit.
Yeah, I know you mean.
I made my bread and butter working on chronic pain, and I understand chronic pain. And do I still have a little more tension on this left side? Yes, but my arm doesn't hurt every day. If I take this and come in and go, oh yeah, right there. Oh, the cross fiber, oh, right there. It'll start to light up. It feels tender, but it doesn't feel like I'm in pain for 3 months that won't go away. When you talk about numbness, or you talk about tingling, for me, that's just another day at work. The
Gotcha.
difference is I just want you to go slow and get familiarity with your body. The main
Gotcha.
issue that I see is if you're right in the armpit or this
Yeah.
area right here, between the radius and the ulna, you get your ulnar nerve.
Yeah.
Now, do you
Yeah.
ever get your funny bone?
Yeah. What do you
Ulnar
mean?
nerve. And when you hit right there, it clips it, right? So what
Hmm.
happens if you get the ulnar nerve in here and you put way too, like I work on you and I take an elbow and just
Yeah.
dig it into here and press on the ulnar nerve. Not a good idea. Makes sense?
Yeah. I know what you mean.
And the thing is, it's taken me years and years because massage therapists are taught in school, don't go into the armpit.
Yeah.
And I go, but I had a problem with my coracobrachialis, and my
Yeah.
coracobrachialis goes right up in my goddamn armpit.
Yeah. I
And
heard
it's
that
like
before.
they're not a 500-hour program for massage therapists is too short and too brief for them to go into that sort of specificity. They're trying to get them ready to do massage, not be manual therapists.
Gotcha.
I was the one who had to experiment on my own body and go, well, what is? And I get right up in here into the coracobrachialis. And I remember doing this and it like lit up like a quarter out here.
Hmm.
After my thumb got tired, I relaxed. And when I lifted my arm, it went crack because that muscle is pulling on my shoulder joint and holding it off. Does it make sense?
I hear you. Yes, sir.
What I don't want you to do is if you feel tingling or you feel limited blood flow or you feel some temporary numbness, I don't
Mm-hmm.
want you to have fear. I just want you to slowly work on the stuff and see if it improves. If I
Yeah.
get a little tingling or numbness, that's just another day at work. I do stuff
Okay. Yeah.
where massage therapists have problems with their arms. So I
Mm-hmm.
literally come over, just put a foot right in their forearm. And I'm
Yeah.
super pale. Their hand goes completely jaundiced. It's cut off blood flow to their hand. They're going, I
Okay.
don't know if this is safe. And I'm like, I do. I've been doing it for 20 years. Give me a second. And when I let off, their blood flushes, through their hand. And they're like, for them, the way they're taught in school, that's a little scary. Does it make sense?
Yes,
For
sir.
me, that's just another day at work. When you work on yourself, I say that your body knows best.
Yes, sir.
Intense is fine. Ooh, I feel that.
Yeah.
I don't want you to do it where your body's like, hey, you need to back off. It's too deep. It's
Yeah.
too sharp. You have to
Yeah.
honor those messages. Make sense?
Got it. And I
Yeah.
also forgot to mention, I guess I've been doing this for a year sometimes, but when I strain my elbow, strain my arm, like the lateral epicondyle,
Yeah.
right? I'd say like the space in between that, like where you would have tennis elbow, right? The bone, like space in between that. Just sometimes it can be really bad pain, like the shoulder, but it would pop and it would just hurt. So I don't
Yeah.
know about that either. I'll just include that.
Once you start working on stuff like across
Yeah.
the joint, it
Yeah.
can be exceedingly complex. There's no reason you couldn't take that chair. And if
Uh-huh.
you find out it's over here,
Yeah.
you're
So
rolling
just,
on it.
yeah.
If you
Okay.
find out it's over here, at least on this, you can start to grab with
Those,
your hand and like, oh, good God. Ugh. Right?
yeah, the brachioradialis, right? The muscle.
Yeah. I
Yeah,
mean, no.
gotcha.
And the thing is, when I do this,
Okay.
I can sit down. I'm the guy, right?
Yeah.
I can sit down and go through an anatomy chart and be like, I don't remember brachioradialis. Where is it? Okay. And then work on that one specific muscle to try to
Uh-huh.
access whatever's going on. But it's like trying to memorize every origin and insertion is like a nightmare. It's like, it's too much. But if I find, right there.
Yeah.
Is there any reason I can't go up to the wall with a tennis ball and just lean in right there? Because my thumb's going to give before that tennis ball does. Does it make sense?
Gotcha.
The challenge is when they have an elbow problem, it's usually something crossing the joint.
Okay.
When they have a wrist problem, it's usually something crossing the joint. And when they
Okay.
have a shoulder problem, it's usually something crossing the joint. Yeah.
Yeah. Okay. Yes, sir.
So you were having more problems on one side or the other?
I would say, I guess both, honestly.
Both?
I mean, I could show you real quick. I mean, it's hard to explain, but like eighth grade year, I mean, I remember I had some shoulder pain, sorry. And that's, sorry, give me a second to look this up. But you know how you have a pull-up bar, right? Well, mine was so low at the door, whatever, I could literally lean into it, sit on the chair, right?
Yeah.
Right. And sometimes I'm like, this was like in 8th grade, so like 4 years ago. I would like, try to, I was kind of hard, but like lean and like move into like, like lean into it with my arms coming back. I guess,
Yeah.
I'll just play around with that. And I don't know if that was like another cause, but I mean, yeah, that's also, I remember like I kind of maybe messed up my shoulder. Maybe that was the beginning.
Yeah.
But I mean, there's also when I was little, like I was on ADHD medicine, and I would like have this like medical tick, right? And make my arm didn't go up. And it was so bad that like I had like no cartilage in my thing, right? That's what they
Yeah.
told me. And they said, oh, and I don't know, maybe I should check up on that, but I never
Yeah,
really
I mean,
heard it.
if you continue to have issues and you need somebody
Yeah.
to look at it, you're probably going to want to talk to a doctor who might refer you to like a physical therapist. They have tools and equipment to scan and see what's going on.
Gotcha.
If people have a bursa issue, it's
Mhm.
like, okay, there's only so much I can do because I'm just soft tissue. If they have some, tear in like a ligament, I can only do so much because I'm just soft tissue. Does it make sense? Yeah, it's like the end of it for me is like I'm always working with people on pain. If I can
Mhm.
get the pain to go away, then awesome, because I'm not doing anything that's permanent. It's not surgical, it's not medications, it's not whatever else. I'm an honest mechanic, basically. I work on people in pain daily to just help reduce their pain symptoms. And let's go so far as to say some people, they have a herniated disc.
Yeah.
I can't do anything for a herniated disc, but guess what's happened when they herniate a disc? It hurts. Muscles around it clamp up to try to protect. They
Mhm.
come in, and for me at an 8, I work on them and they drop to a 4. And they're
Mm.
like, I don't understand. I thought I had a herniated disc. And I'm like, you do. I just got the muscles to let go and the disc is still herniated.
Gotcha.
The
There you go.
doctors, good doctors, don't want to put you under the knife. They
Yeah.
want to keep those surgeries at bay as long as they can because the surgeries improve over time and they're less invasive.
Gotcha. Yes, sir.
Yeah.
Sorry, I'm just getting a charger.
Oh, you're fine.
I know what you mean. So, with your online thing, right? Is there like an online thing I could buy or something, or what's that?
So let me talk to you about this real briefly. And this is actually good market research.
Mm-hmm.
One of the things that I'm working towards, and I'm having challenges with like business growth,
Yeah.
is I want to be able to offer to the public the same sort of stuff we're doing.
Yeah.
It could be private live streams. It could be slightly group live streams. So I teach a little class on the rotator cuff,
Mm-hmm.
and I teach 6 people at once how to generally work on infraspinatus, supraspinatus, teres major, teres minor, subscap, serratus anterior, different muscles, even though serratus isn't a rotator cuff muscle. It's like stuff that might be causing shoulder pain.
Mm-hmm.
I can produce those. What I'm trying to figure out is I'm used to teaching massage therapists, and I'm trying to figure out how to transition the curriculum to something that's more specific for the public. Does it make sense?
I hear
Now,
you.
for instance, do you work on someone else and do they work on you?
No. I think last year I was having numbness when sleeping or whatever, and I went to like a chiropractor.
Yeah.
And he said it was cervical. I think he maybe find the email, but it was up in my neck maybe. And he wanted to do all these X-rays, and I just thought maybe they didn't really help. I'd say so. I just kind of stopped going there. But
I
no,
almost when you sleep, what position do you sleep in?
hardly. It's my belly, and like yesterday or whatever, I slept like this, and like
Yeah.
my belly. I had numbness, or yesterday night, so I changed. But yeah.
So when you turn your head to one side,
Mhm.
guess what happens to these neck muscles compared to these?
They tighten. Or
These are
like,
lengthened, these are shortened.
gotcha.
Now, these are lengthened, these are shortened.
Mm.
you have to sleep however you sleep. 9 times
Yeah.
out of 10, when people come in and they say, I have a crick in my neck, their scalenes have gotten shortened on one side because they slept so long like this that the muscles just like kind of spazzed out.
Yeah, I would like to sleep
Yeah.
on my side, but I mean, it just hurts, to have that pressure. I mean, even I put like a pillow on something, like I put a pillow on another pillow, and I have so
Yeah.
it's not so much external rotation, and it's still. I mean, it's just I would say a little bit of pain, but not much. But I mean,
Yeah.
it's still like yeah, I guess. But yeah,
Yeah. The the challenge is it can come from different things. You just have to sleep however you sleep comfortably. And then when you are awake, you can work on some of those muscles and see if that mostly lets go or unwinds.
yes,
In the
sir.
short term, it's like, yeah, I mean, it's not necessarily the best to sleep on your stomach with your head turned,
Yeah,
but some people can't sleep on their back or they can't sleep on their side. So not getting sleep increases your pain levels.
gotcha.
Yeah. So the issue I'm having is when you asked about when you ask about if there's something you could buy, is
Yeah.
if you have a friend or a girlfriend or somebody who wants to work on you, I have
Mm-hmm.
tons of video to show you how to work on other people.
Okay.
I don't
Okay.
have as many to show you how to work on yourself. I'm trying to figure out how to structure things, and something that's coming up. We're not there yet. We're way behind schedule. The problem is my students will get like a video, like how long, what do we meet? 2 o'clock? We've been here an
Yeah.
hour. Are
Yeah.
any students going to sit down and watch this video for an hour?
I would say not. No, not a lot of
It's
people.
too long.
It is. Yeah.
They're like, no, but I just want this one thing.
Yeah.
And I go, well, I kept giving you sequences. And they're like, it's
Yeah.
too long. And I'm like, ugh.
I know what you mean.
I have somebody writing HTML code for a body map. You
Mm.
click on the shoulder, it gives you a choice of like what muscles might be causing shoulder pain here. They click on the deltoid, and when they click on that specific muscle, it shows them table, mat, suspension, and self-care. The
Whoa.
self-care video is the one you're talking about.
Gotcha. I mean,
So if you, as part of the public, had a body map that was completely filled out, and you went, my knees bother me, click, oh my God, you mean, oh my God, you mean you broke it down by muscle? And I'm like, sure, I can show you how to work on somebody else, table, mat, or suspension. But the self-care video is what you're asking about. One of the things I think is going to happen, we're not there yet, is I'm trying to work with people like you to figure out how do I supplement what I currently have to give you the stuff that you need easily. I think that that body map is as close as to like quick and easy as I can give, because the students can't figure out like what, I don't know how to explain this. They'll come in and say stuff in our private Facebook group. My client has shoulder pain. And I'm like, what do I do for my client's shoulder pain? And I'm like, where on the shoulder? And they're like, I don't know. They just have shoulder pain. And I'm like, front of the shoulder, back of the shoulder, inside of the shoulder, like when they lift their arm, what are they doing? And they're like, I don't know. And I'm like, dude, it's like, you ever listen to Click and Clack, the Tackert Brothers car talk?
I have not. No, I'm sorry about
It used to be on NPR, and these guys were physicists who became mechanics. They got their, I think, undergrad degrees in physics. And basically, the guys would call in and be, I got an 82 Toyota. I pull up at a stoplight, it dies, it'll restart, but then it's like, and they would over the phone diagnose what was wrong with the car. And I was like, dude, that's awesome. That because they understood the inner workings of the car itself. That's the sort of stuff I'm trying to give to not only my students who are therapists, but also the public. What I don't know is, does the public want a little group class for the rotator cuff?
Gotcha.
Or are they more interested in that body map where they could just find one muscle?
Gotcha. Yes, sir.
It's like I can teach group classes, I can teach one-on-one just like we're doing. Anything I do one-on-one slows it down a little bit because you can't like scale it up, if that makes sense. Yeah. But there's no reason I can't continue doing that. Like in the new year, I'm doing my yoga therapy class here in Austin. But if you take the body work stuff I do and merge it with yoga, I'm literally like working on your shoulder, talking to the other students in class, like lift your arm
Yeah.
there, turn your rotate there, turn your head, tuck your
Okay.
chin
Yeah.
towards your knee while I'm working on you. And then I just keep rotating through the students.
Okay.
Yeah.
That's pretty cool.
Yeah.
All right.
How does this feel?
Honestly, yeah, right now, yeah, it's pretty good. I would say this. Oh yeah, the infraspinatus when releasing, say that, it would definitely the pain would stop. I forgot to mention that. Like instantly, yeah, like right after, yeah,
Yeah.
it'd be pretty much amazing. Yeah.
Infraspinatus, if
Mhm.
it's an issue, in my experience, it'll just require some regular maintenance,
Gotcha.
especially if you're doing stuff. Because when you do this, you can put your hand on your infraspinatus.
Yeah.
Now lift your arm.
Yeah.
Wave at somebody.
Yeah.
Because the thing is, we're doing this all day. Like I see people, they paint houses. One of the
Yeah.
worst ones was a guy. I was like, "What do you do for a living?" He's like, "I hang sheetrock," and I was like, "Oh," because it's like he's doing this all day, holding that to like use the
Yeah.
nail gun or whatever or the
Mhm.
screw, the drill to put that in. So we're good for today, I think. Does that give you some basics of stuff you can work on?
Okay. Yeah, it does. So for the scalings, right, to release it, should I just try to go back and forth?
Let's do this. Do you want to do
Uh,
another pass of the same muscle?
what do you mean?
Just go
So
over it one last time.
yeah, sure. Yeah.
Okay, I'm gonna make my camera zoom in a little bit so you can see this a little better.
Hmm.
But you find the SCM,
Yeah.
and the SCM pulls away. I can grip it right there, but I'm gonna
Uh,
stay behind this muscle.
got it.
And when I'm behind it, I can use my thumb. Sorry, I'm trying to get the angle right here.
No, you're okay.
Because I can run the finger back and forth. That anterior scalene, I move my thumb down just a little bit.
Yeah.
As soon as I press in there, it lights up in my shoulder. As soon as I press, ugh, like I feel it like run out and down.
Gotcha.
I say you could easily do that 2-3 times a day, no
Mhm.
issue. All
Gotcha.
you're doing is putting a little pressure on it. Sometimes it'll be the upper portion. A lot of
Mhm.
times I feel the lower half is one that kind of refers out to the shoulder and down the arm.
Okay.
Yeah.
Yeah. Yes,
And
sir.
then I have people work on both sides because they get a chance to experiment and feel it. Like, in other
Yeah.
words, I don't have any problems with my right shoulder. My right shoulder generally feels better from what we've done just today,
Hmm.
but I don't have any pain. It's just a little
Yeah.
tightness. When I go
Yeah.
to the opposite side, same thing. This is the SCM. I'm behind it. I don't know if hopefully you can see that on camera.
Yeah.
And as soon as I press in, I'm pressing straight into the body of the vertebra. It lights up right along the shoulder there.
Gotcha. Okay.
Now, the anterior scalene is the one that's in front.
Hmm.
There's a scalenus medius and a scalenus posterior.
Got it.
They're slightly different origin insertion. It's just easier to start with the anterior and press on it, and then slowly kind of work your way back and down to be able to get to the third one. They'll cause like really crazy referred pain patterns, especially down the arm. But
Mhm.
I see people, they'll get a fork in the chest and they'll get that oval on the back side of the shoulder blade on the affected side.
Okay.
Yeah.
All right.
Cool. So let's do this. I got your contact information. Go
Yes,
ahead
sir.
and use this for a couple of days, see if
Yeah.
there's any improvement, and then I want you to email me and tell me.
Of course. Yeah.
Okay. And
Sure.
if we need to do another one because you have questions or you
Yeah.
refined it, you think you found another muscle, just let me know. We could do that.
Of course. Yeah. Thank you so much, sir.
Cool. Anything else?
I guess I have one more question. So, like
Yeah.
the axle, whatever, right? It's like so it's on it's the bone, right? The border right here, right? And I should just can I use a golf ball and
Yep.
Yeah.
Yep. So
Okay.
the main issue, remember we talked about the ulnar nerve and like right in the
Yeah.
armpit?
Hmm.
Back here, it may feel intense, you may feel
Yeah.
discomfort,
Yeah.
but is back here, it's muscle you're pressing on, relatively safe. You'd really
Yeah.
have to force yourself into pain to be able to cause a deeper issue. Does it make sense?
I hear you. Yes, sir.
You literally have to just force your body, to
Gotcha.
like feel discomfort or whatever. It's like in the short term, you're just working on it to try to help it improve just by sending a stimulus into the muscle itself. It's not about pain. We're trying to get that to
Hmm.
go away, but it can feel uncomfortable, very intense while you work on it.
All right. And then one more question. I know you have like a massage thing for like the coracoid brachialis. And that one, I noticed with your infraspinatus one, like one of the first ones, massage to now, that in that one you kind of just, moved your arm a little bit, but now you kind of, I guess in other patients you would move their arm. Can I do that with
Yeah.
yours? Yeah. Okay.
Yeah. So the reason I don't deal with a huge degree of movement is we
Yes,
got to
sir.
find the muscle first.
Got it.
Then we start to like move around it. Once you
Okay.
start moving it around, it's like a moving target. It's a little harder to discern like where to press. So for instance, coracobrachialis, since you brought it up, it's
Hmm.
right in between the bicep and the tricep.
Yes,
And
sir.
if I put my thumb right here and pull
Yeah.
my arm down, I feel it pop up. If I
Okay.
squeeze my elbow into my side, I feel it pop up. I feel it pop up. I feel it pop up. I'm right in that spot I told you not to go into.
Yeah. Yeah.
I feel it pop up and I stop and I go, okay, right. Okay. I feel the muscle pop up. I relax and I just use my thumb and press right into that muscle.
Yeah.
If I feel like I lost it, all I got to do is hug the arm in and just relax it for a second.
Yeah.
And all I feel is just tender where I'm pressing, where that thumb pad is. But
Mm.
guess what? I'm starting to feel numb and some weird sensation down to my palm because it's probably getting to the ulnar nerve. When I back off, it's like I can feel blood flow like return back to my arm.
Gotcha. When I do that, I just feel like, I guess, like the tendon right here. I don't really feel is that it? The tendon?
So this is
That's
bicep,
uh-huh.
this is tricep,
Uh-huh.
and I'll take my shirt off so you can see this more clearly. Let me take this off.
Yeah.
So give me 1 second. Because some of these are hard to see.
Mm-hmm.
But when I get in, like
Yeah.
the coracobrachialis is basically right here. When I take
Okay.
my thumb and pull my arm, I feel it pop up. It sticks out because you're contracting the muscle. When I pull it in, right there.
Yeah.
When I pull it in, right there. If I continue and I do this, I actually moved my thumb just a little further forward. But that's where my thumb is located,
Okay.
right there. When I pull
Gotcha.
it down, I feel the muscle pop up and I keep going deeper and deeper right into the armpit, right on that muscle. When I decide to
Yeah.
really
Yeah.
press on it, I just relax.
Yeah. I feel that.
Oh. And I feel it actually, I mean, I feel tenderness there, but where I feel it is almost down here, like this kind of broad referred sensation.
Oh, yeah. I forgot one more thing to mention, right? So when I was first doing it, I first saw it, I actually moved my arm and there was kind of pain. But
Yeah.
there was also, I guess, like a little bit pain running down my bicep, but also into my arm and into my thumb. Is that normal or yeah?
So the challenge is people will come in. You ready? I have carpal tunnel syndrome,
Yeah. Okay.
scalenes.
Okay. Got
I
you. Yes.
have thoracic outlet syndrome,
Mm-hmm.
scalenes. And I'm not saying it's the only muscle. I'm
Yeah.
saying that the scalenes are involved in
Uh-huh.
what they're having problems with. And that's
Uh,
where the issue is. Somebody can have arm and hand pain. Is that arm and hand pain coming from their rotator cuff? Is it
uh-huh.
coming from the scalenes? Is it
Yeah.
coming from their brachial plexus? A lot of times they have multiple muscles. Massage therapists use their hands. They develop hand and arm pain. And I come in and do this. And I put my foot on a mat right here. And they're like, what the fuck are you doing? And I'm like, watch.
Yeah.
I'm like, now squeeze your hand into a fist. Oh, now open it up, move. Oh, Oh, my hand is numb. I don't think this is safe. I'm like, it's safe. Trust me, you're fine. Is it
Yeah.
painful? They're like, no, but it's intense. I'm like, okay, you're fine. You're right, fine, right there. Now, when I let go, guess what?
Yeah.
All these muscles cross this joint.
Gotcha.
All these muscles cross this joint. And
Mhm.
that's the thing. The person will sit there and like rub their hand, but it's like this is the part of the muscle that's shortening and like pulling across that joint. Does that make sense?
Yes, sir.
Yeah, you'll see that again and again and again. Somebody will come in and have ankle pain, and then
Yeah.
my whole job, they I go, where where in your ankle? Where are you having pain? And when they have pain,
Yeah.
sorry, and when
You
they
know,
have pain, they're like, I feel in my ankle and the top of my foot. And I come in and press in this, and they're like, holy shit. Dude, I'm like, is that the spot in your ankle? And they're like, how the fuck did you? And I'm like, you're addressing the muscles that cross the ankle joint. Just rubbing here, there's not even much tissue here, right?
yeah.
Like there's not much muscle here, but this, it's like I have plantar fasciitis, and I'm like, give me one
Yeah.
session. And they're like, what? I'm like, dude, your soleus and your gastrocs, these
Yeah.
muscles are pulling,
Yeah.
causing pain at the bottom of your feet.
Mm.
That stuff is how I made my living. And it was by, eventually working with you on camera. But that sort of stuff I see again and again and again. The common everyday upper back and neck and lower back and hip pain, I solved that years ago. And I know
Okay.
for massage therapists, that sounds like it's full of ego, but it's like,
Mhm.
give me one session with your clients and let them choose.
All right. Yeah. All right. So I'll work on
They
the
want the problem to go
scaling.
away.
So I'll work
Yeah.
on the scalings and I guess the rotator thing. Yeah.
Yeah.
All
Yeah.
right.
Just get back to me in 2 or 3 days. Try it
Mhm.
a couple times a day. See if it improves. And then we can talk about it next time and see if there's some additional muscles or something we can address.
Of course. All right.
Yeah.
Thanks so much, sir.
Oh, you're welcome. Hey, listen, I'm probably going to take this and stick some anatomy on it and put it up on YouTube. Do you care?
No, not at
Okay.
all.
Yeah. I'll just go ahead and do that.
Okay.
All right. Cool. So
Yes,
listen,
sir.
if you have any other questions, just message me and we'll get together again so we can talk about this.
Of course. Thank you so much.
Thank you. You have a good one.
You too.